Hi everyone, Patrick Menninga here, spiritualriver.com. I want to talk to you today about inpatient treatment in terms of overcoming drug addiction and alcoholism. Now, generally speaking, there's a number of different possible solutions and treatment services that you might use to deal with alcoholism and drug addiction. And the 28-day program is kind of the gold standard. That's kind of the top of the heap as far as your treatment options. So you could do other things. You could go to AA and NA meetings. You could go see a therapist once a week. You could go to outpatient treatment. But going to inpatient rehab, going to a 28-day program is generally the best solution for most people. And if you've struggled with drug and alcohol addiction and you continue to struggle, I would really encourage you to go to a 28-day program. Go find an inpatient treatment center and check in. What is it like? Let me alleviate some of your fears about what treatment is like. Because if you've never been to an inpatient treatment center, you should be afraid. There's nothing wrong with that. You should be a little bit worried and say, ooh, I wonder what it's like in a drug rehab center or an alcohol treatment center where you stay there for 28 days. What are they doing to you in there? You should have those kinds of fears and worries. That's perfectly normal. So let me just tell you that it's very non-threatening. They're not trying to brainwash anyone. It's not threatening. Most treatment centers, depending on the state you're in, are completely voluntary. And so once you're in there, there's generally a couple different kinds of staff. There's usually therapists that they'll assign you a therapist and you'll work with a therapist one-on-one. There's generally nursing staff that will help you get through detox, through the medical detox, which might be the first 3 to 7 days that you're in treatment. You might be in a medical detox unit. There'll be nurses. They'll probably consult with a doctor. And so all of these staff, there's usually a mix of people who have been in recovery and people who are not in recovery. And that's perfectly fine. You'll find staff that are very helpful, very understanding, very caring. Nobody's generally talking down to you. Nobody's threatening. It's very non-threatening. So there's generally a lot of groups. Once you get through the medical detox and you're not feeling sick anymore, they'll have you start going to groups and lectures, things like that. And if you have anxiety and you're worried about those, again, I want to assure you that it's fairly non-threatening. You're not going to be put on the spot like you think. It's not as threatening as you may think it might be. So don't worry about that. Even if you're shy, even if you have some anxiety, it's very non-threatening in most treatment centers. Going to inpatient treatment is probably the best decision you could ever make if you're struggling with drug and alcohol addiction. It's essentially a lifelong investment because if you don't go to treatment and you continue to abuse drugs or alcohol, then your life just continues to spiral out of control. It gets worse and worse. You become less and less happy over time. If you do go to inpatient treatment, the return on that is nearly infinite. Once you turn your life around, you no longer have to use drugs and alcohol just to feel normal, just to feel decent, and you get so much freedom from that. So if you're on the fence about this, if you're struggling with addiction or alcoholism, I would encourage you, get on the phone, call up a treatment center, ask them what it would take for you to get in there and start turning your life around. It's the best decision you'll ever make.